Welcome back to the lecture series on repertories. Today we are going to see the topic case taking in homeopathy, especially the case taking in acute cases. First, we will see the definition of case taking. So, case taking is a unique art of collecting all the facts about the patient using various tools like observation, perception, history taking given by the patient or attendants or by the bystanders, then by the clinical examination, diagnosis of the case, etc., in order to find a remedy for the patient using our knowledge of homeopathic materia medica, organ of medicine, and repertory. In short, the case taking is a unique art of getting into conversation, observation, and collecting information from patient as well as from bystanders to define the patient as a person and the disease. The history obtained thus makes the basis for a physician to go further into the physical examination and laboratory studies in order to define the problem accurately. Each case is unique in all respects. Only true individualized approach can explore the true picture and help a physician to arrive at a totality in its true sense. Every individual is different in health as well as in disease, and hence every case has to be examined individually, giving importance to its unique expressions during health and disease. Now we will see the introduction part. Hahnemann's classification of disease is purely based on the observations. The signs and symptoms guided him to group of the diseases and not the pathology of the disease. As the presentation of symptoms varies, the physician should have the knowledge of different type of diseases, and the case taking advices or advised by the Hahnemann in each class of cases. Hahnemann has classified diseases on the basis of causation into acute and chronic. The disease produced by an exciting cause is known as acute, whereas the disease manifested as a result of fundamental cause is known as chronic diseases. These diseases differ in their onset, progress, duration, and in outcome. Therefore, the scheme of case taking should also differ in acute and chronic cases. The physician must be alert to recognize the hierarchy of life threats: critical, acute, urgent, non-emergent, to plan case taking and management. Now we will see the acute cases. Or acute diseases are defined as diseases which begin suddenly, progress faster, run a definite course, and finally ends with recovery or death. They are caused by an exciting cause or acute miasm. The acute miasm comes on either with sufficient violence to cause death of the patient or with less violence, wherein there is a period of progress and a tendency to recover. Acute miasms are of two types: Recurrent acute miasm. Recurrent acute miasm attacks a person several times in his life in the same manner. These are almost common in everyone. For example, typhoid, malaria, cholera, etc. Non-recurrent acute miasms. The acute miasm attacks a person only once in lifetime. It is also called as fixed miasm, as the attack is fixed only once in lifetime. For example, smallpox, measles, whooping cough, etc. While attending to an acute case, the physician should limit his inquiry to the recent deviation from health. Since acute diseases require immediate medical intervention, one should not waste time in collecting details of constitutional state and should confine himself to the presentation of the disease. Undoubtedly, the physician should not miss the picture of the disease and its effects on the whole person. Therefore, in acute diseases, the physician should be able to collect two important aspects of the case. 1. Presenting complaints, which can be described in four components, that is, location, sensation, modalities, and concomitant. Second one, the feature at a general level, changes on the physical plane like appetite, thirst, thermal reaction, respiration, bowel movements, etc. Changes on the mental plane like irritability, confusion, fear, restlessness, etc. The above information forms the basis of treatment of acute diseases. Contrary to the general belief, the treatment of acute diseases is much easier by the homeopathic mode of treatment because the manifestation and picture remains clear to the patient and the physician. Hence, difficulties in forming a totality and selecting a remedy are minimized. Hahnemann classified the acute diseases into three types: individual type, sporadic type, and epidemic type. As per the case taking advised by Hahnemann, the sporadic and epidemic can be grouped together. In individual and sporadic type of acute diseases, which are caused by unfavorable conditions and meteoric or telluric influences respectively, the patient are inquired into based on the above scheme. In case of an epidemic type of acute diseases, the physician no doubt takes into account all the changes at sector and general levels, but he soon discovers that there is a likeness in the presentation of cases being reported to him one after another. After attending a few cases, he finds that other reporting cases present no new symptoms or they present with a slight variation while they repeat the same manifestation and expressions. At this stage, the physician has obtained the total picture of the epidemic disease. This total picture is the totality of the epidemic disease and suggests a remedy which can be used for the treatment of all the cases of that area presenting with the same complaint. This medicine can also be given as preventive medicine. This type of medicine, which is based on the totality of the epidemic disease, is known as genus epidemicus. In all types of acute diseases, that is individual, sporadic and epidemic, the obtained information is made use of to form an acute totality so that the selection of the remedy becomes easy. Now we will see the acute totality. Acute totality is the sum total of the characteristic symptoms expressed during the course of an acute disease or acute exacerbation of a chronic disease. The characteristic symptoms may be expressed on the affected part or at the level of the sector and at the level of generals, mental and or physical. For example, during an attack of diarrhea, the characteristic symptoms at the level of sector could be the changes in color, quantity, smell, etc. of the stool, along with the presence or absence of various sensations or pain with the stool. The characteristic symptoms on the general level could be changes in the mind or body during the attack or during the acute attack of diarrhea, like irritability, increased sweat, etc. The characteristic general symptoms during the acute attack are basically the concomitant symptoms and are also called fixed generals. They are called fixed generals because the general symptoms expressed during acute diseases do not change or change slowly compared to the fast changing symptoms of the sector or the affected part. While forming a totality in acute cases, both the characteristic sector and the general should be taken into consideration. Therefore, acute totality means the sum total of characteristic symptoms and the level of sector means affected part and general expressed during the acute stage of an illness. It can be summarized as mentioned below. Acute totality is equal to sector totality means including characteristics, particulars, location, sensation, modalities plus fixed general totality means mental or physical symptoms or concomitants. Now we will see the summary. The symptoms of the acute disease evolve quickly and the patient remembers all of them as they remain fresh in the memory. Sometimes the disease runs a rapid course and deserves serious attention. The second one, it is very easy to take a case in acute diseases because all the phenomena and the deviation from the health that has been recently lost are still in the memory of the patient and relatives. The third one, identifying the exciting cause is the most important step in the treatment of the acute diseases. Fourth one, if the condition compels for an immediate intervention, the physician may consider the totality of the symptoms formed together by the medicinal symptoms and original disease, which is known by the name conjoint malady. Fifth one, in order to form a totality of an acute case, the physician should concentrate to elicit the acute deviation in the different spheres, which includes the presenting complaints, characteristic symptoms of the patient, mental generals, and physical general. Sixth one, as an acute condition that appears during the course of a chronic disease, supervenes the chronic symptoms. The physician should exclude the chronic symptoms from that of acute in acute totality and should not consider both of them as they are not the manifestation of a complex disease. The seventh one, the physician wants to know everything in such cases also, but he has much less to inquire into. Eighth one, in acute disease, the presenting complaints are very prominent and impress our senses quickly. So much less time is required for tracing the full picture of the disease. The ninth one requires only few questioning. Almost everything is self-evident. Tenth one, evolution of symptoms are very quick in account of disease and the patient remembers all of them. 11th one, any known causative factor for the explosion of the latent sora is to be ascertained. 12th one, physical examination and laboratory findings to be noted. 13th one, possible nosological diagnosis should be kept in mind for diet and regimen, etc. Thank you for listening the lecture on case taking in acute cases. If you like the video, then please do subscribe and share. Thank you once again.